Welcome to Therapy Tips with me, ChadGOrthoOT. I hope you enjoy the video. So I'm going to show you a couple of techniques that you can do if you're lacking knee extension. That last bit of either straightening out the knee or if your knee is not bending very much, how to start getting that knee movement. So the first one I'm going to do, we're going to say that Kinsley does not have full extension, right? She's lacking maybe 10, 15 degrees here. The knee's bent, doesn't want to go all the way out straight. So what you can do is I'm going to take this little half bolster. You can take a towel roll. I'm going to put it under her upper calf area, just below the knee. Okay, I'm going to take this hand, put it just above her kneecap. I'm pushing down on her femur for a dorsal glide with this hand. With my other hand, I'm going just above her ankle. And so I'm doing two movements here with her tibia. So I'm extending the knee and I'm externally rotating. And then at the same time, I'm pushing down on her femur for a dorsal glide. And I may sit here and oscillate this back and forth. I may let her go through the movement and I finish it out with that glide. So that's a great technique to be able to do if you're lacking that last little bit of extension. And now I'm going to show you the technique that you would use if you have very limited knee extension. And so this technique is going to be used if we have very limited knee extension. So the knee is stuck in knee flexion, somewhere around 60 degrees. We're still lacking a good bit of range of motion to come all the way out. So what we're going to do on this is I have that same bolster or towel roll put underneath her thigh, so just above the knee, so it's underneath there. I'm going to take one hand, go just below the back of the knee on the upper calf area, so I'm pushing down like this, right? So I'm basically going in this direction with this hand. With the other hand, I have her just above her ankle, and at the same time, I'm pushing down here on her tibia, and I'm rotating her tibia externally, and then I'm going into extension. And so I'm doing just like this. So I have two movements happening here with a rotation as well as going into knee extension. And with this hand, I'm creating that glide so that I have both the glide and the roll at the same time. And this is a great technique, and I would just do this to her tolerance for maybe 10, 15 repetitions several times a day. I hope these techniques help, guys. Make sure you head over to my website, ChadGOrthoOT.com. You're going to find information related to orthopedics, sports medicine, rehabilitation, and links to some awesome products. Thanks so much. We hope you enjoyed the video. Please make sure that you like and subscribe so you can stay up to date on all of our current content. Thanks so much.